So getting to the actual product itself, in a couple of my previous slides you'll have seen a yellow coloured box. This was the one we originally had and has now been replaced with this opaque container which is sealed with red tamper-evident tape. It contains a pre-filled syringe of naloxone hydrochloride, 2 milligrams in 2 mils, which is 5 doses. There are 2 1¼ inch muscle needles, a generic patient information leaflet and a flow chart describing what to do in an emergency situation. This currently costs about £11.32, which I believe is approximately 18 Canadian dollars, but feel free to correct me if I'm wrong there. And the Scottish Government currently reimburses health boards for this cost. At the moment, this is not a licensed community pack, although the naloxone itself is licensed. So what happens is the naloxone in its container is sent to a third-party assembler in Scotland who adds the needles and the flow chart. They also physically draw on the black lines on the dosing schedule to make it clearer. And it's distributed from there. What would happen at the moment is if a GP was to prescribe naloxone, all that would arrive in the chemist would be the box itself, and no needles and no flow chart or anything like that in it. Sorry, just going back, what I should probably say as well is that a licensed pack would make it much easier for GPs to prescribe. Intramuscular administration is the only route currently licensed. However, there is a pilot of intranasal in Inverness in the Scottish Highlands at the moment, which we're looking closely at. The naloxone programme data is monitored by Information Services Division Scotland, and they produced the first annual report in July 2012. You can see there that there were 3,500 kits supplied, 2,700-ish in the community and just over 700 by the Scottish Prison Services. 145 repeat supplies were made due to reported uses in an overdose situation. This was a great start, but we definitely need to increase these numbers of supplies if we're to have an impact on drug-related deaths. So this is some of the activity that you can see here, lots and lots of training and awareness. There was a protocol developed with the Scottish Ambulance Service so that if someone calls 999 and tells the emergency call handler it's an opiate overdose, there's a procedure in place to ensure people are given guidance on naloxone administration if they have it available. Going on, the previous national coordinator did a lot of work around obtaining the licensed community pack, which we hope to see very soon. We have a variety of social media, including the Naloxone UK Twitter page, we have a Facebook page, and of course we have the website there as well. There was also input into the overdose app for smartphones, which was produced by U-Turn Training, which is an absolutely brilliant resource. It has a section on it that's for use in an emergency. However, it's actually really good as a training aid. Unfortunately for yourselves, it's actually only available in the UK and Ireland at the moment. But it is a very good resource that's being used over here. And of course, the exciting development of peer education networks, which I'm going to tell you a bit about. This was originally my focus when I started at Scottish Drugs Forum. There was the development of all the training and resources around this programme. The criteria for people to be involved was that there were groups of 6 people or more who were currently attending a drug service with a history of or current substance use. There also needs to be a service lead prepared to support the group in their activities. These images that you can see down the side there, they make up a sort of fold-away wallet-sized training aid with a detachable proof of training card for the peers to use. And the logbook at the bottom is an A6-sized booklet with carbon-copied monitoring information, and I'll explain a bit more about that in a minute. The actual training takes place in kind of 3 parts over the period of approximately 1 month. There's a half-day drug awareness session that specifically looks at attitudes and values. Then there's the full 2 days naloxone training for trainers, followed by a further half-day pulling it all together. And this time is really used to discuss all the practicalities of how to put their training into practice. Following this, they record their activity in their logbooks, and the service lead ensures that this information is collated and returned to myself. For 6 months after the training, I attend monthly meetings with the group to offer support and encouragement, do a bit of refresher training and give a kind of national update on other things that are happening. But it's really for them to lead the meeting. They have a chair and somebody takes the minutes. And it's really to look at any kind of issues that might have come up for them during training or some of the great work that they have already been doing. There are some incentives attached to the programme. For full completion of the training, there are vouchers and certification. Vouchers are then also supplied for attendance at the monthly meetings afterwards. Groups are provided with a resus mannequin for training, ID cards, and the possibility is always there for access and further training. I think most of the guys that have been involved in the training so far would tell you that actually they weren't doing it for any kind of incentives, but actually they were just really keen to make a difference in their communities and to try and play a part in reducing our drug-related deaths. Some of their activity to date, I mean, they've done a huge amount of work so far and I've really enjoyed this part of the job. 29 people have completed the training in 3 areas. They have done over 300 hours of work, which has included attending meetings, linking in with the local coordinators to work with the community addiction teams. So that would be where a nurse, say, has a full clinic of people attending. Peer educators are present in another room to offer naloxone training, and then the nurse is there to supply it. And it's really similar with the pharmacies in Glasgow. There's a pharmacy pilot for involvement with the programme. Peer educators have been invited on site in some of these stores to provide training to people that might be attending for their prescriptions. And then the pharmacists are available to make the supplies and naloxone at the end of that training. And this really is a massive achievement, and the guys have worked extremely hard to build relationships in these areas. And I think peer involvement is absolutely crucial in this programme. It's important that this happens on every level. It's not just about the training, it's actually some of the myths that they're able to dispel in the communities and engaging people and getting more people to know about naloxone itself. I'm pleased to say that they also sit on some of the local naloxone steering groups to provide an essential contribution to that. So some of the key areas of work over the next year, one at the top there is definitely to get me a colleague, to definitely expand the peer networks and look to achieve this in the Scottish Prison Service. At the moment, Inverness has a peer trainer in the prison there, and I'd really like to see that in every area in Scotland. To support the delivery of naloxone in the prisons and in the communities, identify training leads to take on the training for trainers in local areas. There will be engagement with the police, particularly looking at having naloxone available in custody suites. We have a whole range of rebranded training materials to be distributed. Hopefully within the next couple of weeks we're finally at the stage of having them to the printers. With regards to GPs, general practitioners, there was a recent report published on the engagement of GPs in the naloxone programme here. This was really the first step to seeing how we can involve them and what they might need to become more involved in the naloxone programme. The report is available to view on our website, as are all the other reports that I've mentioned today. This is a statement from the National Forum on Drug-Related Deaths annual report this year. So just to really just to say that the overarching aim for Scotland is to ensure that the provision of naloxone supply to people at risk of opioid overdose is standardised, normalised and prioritised. So if someone has a history or active use of opioids, they should be afforded naloxone without hesitation. The number of naloxone kits being supplied to people in the community must be significantly increased in order to have an impact on the tragic number of drug-related deaths in Scotland. To be honest, it's my personal opinion that if we have around 25,000 people on methadone, then we should at least have that number of take-home naloxone kits out to people.